Are you curious about the peptide craze in medicine? Are you wondering if they can be beneficial for your chronic pain? If so, you're in the right place. Because in this video, I'm going to break down the science of peptides and why they can be beneficial for chronic pain. By the end, you'll be able to make a more informed decision if peptide therapy is right for you. Peptide therapy is all the craze in medicine right now. So you're probably asking yourself, will this be beneficial for my chronic pain? But maybe you're also a little skeptical just because you've been burnt by all the promising new advancements in chronic pain treatments over the year. So here's what you need to know about peptide therapy before you drop a couple $100 a month on it. So what is a peptide? Well, before we even have peptides, we have amino acids. And think of them as little building blocks. Multiple of those bind together to create a peptide, which is like your foundation in your blueprint. Then peptides bind together to create a protein, which is what is actually doing all the heavy lifting in your body. You can think of it as the finished product, like a house. What is so cool about peptides is that they're not just smaller proteins, they're also signaling molecules. So they tell all the cells around them what to do as well, coordinating everything from growth to immune function. And we like them in medicine because now we can have a more targeted approach to the therapy. We can tell all the cells in that area what to do specifically, whether that's more clearing inflammation or building up damaged tissues. In the context of chronic pain, there are 3 peptide injections that are a little bit more used than others. And to give you some context about what peptides can do, we start with BPC 157. This helps with connective tissue repair, helps decrease gut inflammation, which is a big driver of chronic pain conditions, and helps increase blood vessel formation. So like if you have fibromyalgia, all those tender spots tend to be devoid of oxygen, so helping boost up your blood supply to those areas can greatly help with those tender spots. Thymosin beta 4 slash TB500, again, just general tissue repair, general anti inflammatory peptide. And then we have G4K slash CU. This is a copper binding peptide, helps with collagen remodeling, and you guessed it, decreasing inflammation. If you're considering peptide therapy for your chronic pain, just know that there are some downsides. And of course, we have some thoughts about them at True Health Centers. So the first, peptide therapy injections are passive treatment. And we know that passive treatments just do not work as well as active treatments for treating chronic pain. They're not as effective and they're not as long lasting. However, there is certain circumstances where this is going to be more beneficial. If your chronic pain and fatigue is so severe that you can't even do active treatments, then we're going to want to look to something like peptide therapy to get you out of the danger zone, get you to a place where you can actually do and reap the benefits of active treatments. Next, your body already makes peptides. When you consume protein, your body breaks them down into amino acids, then reassembles them into peptides and ultimately proteins. So, if you're feeling like maybe I should try peptides, a good place to start is just consuming more protein. Right now, the RDA is like 0.8 grams per kilogram of body weight. Sorry, you're going to have to do the math and conversion on that. That is way too low. We want to be more between 2 to 3 grams of protein per kilogram of body weight. That's really where you're going to reap the benefits. But you also need to do this consistently. So make sure that you're tracking your protein intake, either with a food diary or an app. But if you are consistently getting this much protein and you're still not reaping the benefits, then we need to start thinking about absorption, because just because you're consuming the proteins doesn't mean you're actually digesting them well. Certain things like intestinal permeability or leaky gut is going to decrease how much of that protein you actually absorb. Dysbiosis, the level of good bacteria to bad bacteria. If that's off, that's going to affect absorption. Transit time. If you are either pooping too much or not enough after a meal, so your transit time is too fast or too slow, that can interfere with absorption of proteins. But most importantly, decrease stomach acid. You need stomach acid to break down proteins. So if you're taking an antacid proton pump inhibitor, you're greatly going to reduce the amount of protein that you are absorbing. And then if you have a deficiency in protease, that is the digestive enzyme that helps break down proteins. It naturally decreases as we age, but we need to maybe look at your pancreas or consider supplementing with protease to make sure that we are getting the full absorption. If after all of this you still feel like peptide therapy is for you, give it a try. There are much fewer downsides to it than other prescription medications. So there you have it. That's peptide therapy in a nutshell. Now you have a better understanding of what they are, how they work, and what kinds are used for chronic pain. Now hopefully you can make a more informed decision if they're right for you, and just one step closer to figuring out your chronic pain.